A new treatment has been unveiled this morning which it's claimed could help thousands of people in the UK who have a debilitating eye condition. It's called dry age-related macular degeneration and is one of the main causes of blindness and visual impairment in the over 60s. It's based on the same principles which were used to fix the Hubble telescope. Our reporter Carolyn Atkinson is at the news conference. She can explain more.
Well, Melanie, 600,000 people in the UK have macular degeneration in some form, and that causes visual impairment or even blindness. And the macula, just the quick bit of science here, is the central part of the retina. It sends signals to the brain so that we can see. And as we age, it can deteriorate. There are two types. There's age-related macular degeneration, or AMD wet, which is much more aggressive, but only 10% of people have that type of AMD. 90% though have this dry AMD, which is much slower, but up until now has been unable to be treated. Now, Bobby Qureshi is a consultant ophthalmologist at the London Eye Hospital. Now, at the moment, what are you seeing when patients come to you, or until you've started this procedure, I should say, but what are they saying in terms of how their life is changing and what they can't see?
Well, this is a disease of elderly people, and it creeps upon them very gradually. And they find that they can't read so well, drive so well, they have distortion or holes in their central vision, and it progresses over years. And up to now, there was nothing we could do. It was disheartening to see these patients come to clinic, and all we could offer them were some vitamin supplements which delay the progression, and magnifying glasses, and just slowly watch them go blind.
And in fact, the only operation you could do was very, very risky and didn't really have great results. And you were putting a fairly chunky bit of plastic in someone's eye, weren't you?
Absolutely. We used to carry out surgeries in the 70s and 80s for cataract surgery, where we would make a very large incision, take the cataract out and put many stitches in. And telescopic implants have been around, and I've been performing them since about 2006. But the surgery required was of this type, with a lot of risk and complication.
Okay, so I'm going to bring in Professor Pablo Artal from the University of Murcia in Spain. Now, you are the technical whiz. Bobby came to you and said, what I'm trying to do is make a better lens, and he had the idea that perhaps how they'd sort of fix the problems on the Hubble telescope could be applied to a person who's got dry AMD. So what did you do?
Well, working hard.
Hours and hours.
But in addition to that, what we were doing is basically getting this small telescope and doing it smaller, so it can be into the eye in a much easier way, and also to modify the optics in a way that provides very good images in the retina.
So instead of a great chunky piece of plastic that went in that didn't really do the trick and was very risky, you ended up with two lenses.
Two lenses that they can go into the eye through a very small incision of about 3 millimeters.
And Bobby, it works in a similar way to the cataract operation that so many people have now and see it as very routine.
Absolutely. Cataract surgery is one of the commonest, safest operations in the world these days. And what we've achieved here is we've got a surgical technique where I can place this miniature telescope. It's the world's first micro-incision telescope for macular degeneration into the eye in a technique which can be performed in 5 to 10 minutes, as safe as routine cataract surgery.
Now, you've done about 100 people already since January, because that's only when you got permission to do it in this country. Veronica, you are one of those people. Tell us what your sight was like before the operation.
Before the operation, anything that you needed, so if you wanted to sew, if you wanted to read, if you wanted to drive, I couldn't read the dials on the washing machine, the microwave, read the clock, just anything you'd use.
So your life really was grinding down in terms of the practical things you could do.
To do with your life. You began to lose independence.
And when you had the operation, which we're told takes about 10 minutes, what can you now do that you had stopped doing before?
Everything. Absolutely everything. I can now drive, I can sew, I can paint and decorate, I can upholster a settee, make curtains. I'm retired. I can do anything I want to do, and it's brilliant.
Bobby Qureshi, obviously you've done it on 100 patients, and there are people at this press conference today from other countries who are starting to do it on their patients, but it is only done at a private hospital. People have to pay for it, and you've only done it on a few people, so you need to start doing some trials, don't you? Because we've been speaking to the Royal College of Ophthalmologists, and they are concerned that this is untested, it's unproven.
Well, regulation within Western Europe requires a certification, and it has got CE regulatory approval as an implant.
But that's the actual device itself. You're okay to use the device, but you can't prove that it actually works.
Well, we've got the data from the laboratory that Pablo Artal has, and Pablo is a world-renowned optical physicist. And in the patients I have performed, if you choose the right patient, we've seen an average of 40% improvement in vision. And you're absolutely right. We do need to have large clinical trials, and we have professors in Germany at the university and Spain undertaking these. And it will be available to all surgeons within Western Europe by September. And I hope eventually it will be adopted by the NHS and be available to a much wider audience.
Okay, Bobby Qureshi, thank you very much indeed. Professor Pablo Artal and Veronica Mackay.